Today I want to talk to you about acid-base balance, and we will start with respiratory acidosis. The main components in the acid-base balance are pH, pCO2, PO2, and the bicarb, which is HCO3. The pH. It defines the acidity or alkalinity of the blood. The normal range is 7.35 to 7.45. If the pH is below 7.35, the patient has acidemia, and hydrogen ion level is increased in the blood. On the other hand, if the pH is above 7.45, the patient has alkalemia, and the hydrogen ion level is decreased in the blood. The pCO2, this is the partial pressure of carbon dioxide dissolved in plasma. The normal range is 34 to 45 millimeters of mercury. Next, you have the PO2. This is the partial pressure of oxygen dissolved in plasma. The normal range is 80 to 100 millimeters of mercury. And lastly, you have the bicarb, which is the HCO3, and the normal range is 22 to 26 milliequivalent per liter. Let me start with uncompensated respiratory acidosis. Respiratory acidosis occurs when the lungs cannot remove the carbon dioxide that the body produces, so that there is a high level of carbon dioxide in the plasma. In analyzing the blood, first look at the pH. Next, look at the CO2. And finally, look at the bicarb. In primary respiratory acidosis, the pH is lower than 7.35, the CO2 is greater than 45, and the bicarb is within normal limit. Something to remember: pH drops by 0.08 for every 10 millimeters of mercury increase in the pCO2 in acute processes, but only by 0.03 in chronic processes. In uncompensated respiratory acidosis, the pH is decreased, the CO2 is increased, and the bicarb is normal. In compensated respiratory acidosis, the pH is decreased, the CO2 is increased, and the bicarb is increased. What are the causes of respiratory acidosis? There are two categorical causes. The first one is reduced CO2 elimination, and the second is increased CO2 production. In terms of reduced CO2 elimination, it might be a result of obstructive airway diseases such as asthma and COPD, or there may be a failure in ventilation and an accumulation of CO2 at the alveolar level, or there may be chest wall disorders, neuromuscular disorders, sleep apnea, head injury, or drug intoxication. In terms of increased CO2 production, this may result from malignant hyperthermia, hypermetabolism, and high carbohydrate diet. What are the symptoms of respiratory acidosis? It might include confusion, anxiety, easy fatigue, lethargy, shortness of breath, sleepiness, tremors, warm and flushed skin, and sweating. And of course, myocardial contractility will be suppressed, as well as arterial vasodilation will occur, and catecholamine release will be increased. Well, thanks for watching this video. I do hope that you will like, share, and subscribe. I wish you well. Good night.